Hi, Dr. Nisha. There are many myths and controversies associated with breast cancer. Could you please clear the common myths associated with breast cancer?
Regarding everything under the sun, there are popular ideas which could make a lot of theoretical and cultural sense, but are scientifically wrong. As oncologists, we get to hear humongous number of such ideas, especially fueled by the Google and WhatsApp university professors. Misconceptions about cancer can lead to needless worry and even hinder prevention and treatment decisions. And hence, I am happy that you brought up this question. Let me try to discuss some of the most common cancer myths and controversies. A very sad misconception that is floating around is that cancer is a death sentence. The fact is a big no. With better and better tests to detect cancer at earlier stages and with advancement in treatment techniques, the likelihood of dying from cancer has dropped steadily, especially since the 1990s. 5-year survival rates for some cancers, such as breast, are almost 90%. However, these rates are only statistics. How long an individual cancer patient will live and whether she will die from cancer depends on many factors, including whether the cancer is slow or fast growing, how much the cancer has spread in the body, how well the patient tolerates the treatment, the person's overall health, and much more. Now, another myth that we hear very commonly is that if I don't have a family history of breast cancer, I won't get it. The fact is that most people diagnosed with breast cancer have no known family history, and only about 5 to 10% of breast cancers are hereditary. The vast majority of people who get breast cancer have no family history, suggesting that other factors might be at work, such as environment and lifestyle. Please refer to the videos by our genetic counselor Ms. Muskan in the first series to know more about hereditary breast cancers. Many of my patients believe that eating sugar makes the cancer worse, or not eating sugar can cure the cancer. No, although research has shown that cancer cells consume more sugar or glucose than the normal cells, no studies have shown that eating sugar will make your cancer worse or that if you stop eating sugar, your cancer will shrink or disappear. However, a high sugar diet may contribute to excess weight gain, which is associated with increased risk of developing several types of cancers. Now, a common myth is also that small percentage of population believe that cancers are contagious. In general, no, not at all. Cancer is not a contagious disease that can spread from one person to another. There can be contagious cancer-causing viruses like human papilloma virus or hepatitis B virus, which might be contagious. A common question that I get is, do cell phone towers or heating food in microwave oven cause cancer? Again, it is a huge no, not according to the best studies completed so far. Cancer is caused by genetic mutations, and cell phones emit a type of low-frequency non-ionizing energy that does not damage the genes at all. And hence, you can safely live near a mobile tower, use your cellular phones, or consume microwaved food. A very common question asked is to whether antiperspirants or deodorants or hair dye can cause breast cancer. Again, no. As of now, no studies have found evidences linking the chemicals that is usually found in these stuff directly to cause cancer. We can't say for sure if in future it is proved otherwise. A very common controversy regarding breast cancer is regarding OCP or oral contraceptive pills. Now, this indeed is a controversial topic with some studies indicating some possibility, especially if taken from a young age, and others indicating that it whatsoever has no connection with breast cancers or a women developing breast cancer. We believe that the component in the OCPs that might contribute in breast cancer is estrogen, and modern contraceptive pills are not full estrogens. Also, I would like to point out here that there is a hormonal replacement therapy that is sometimes prescribed after menopause which has a definite connection or contribution towards breast cancer development. All said and done, make sure that you discuss the pros and cons, available alternative before you decide upon the method of contraception. A very common misconception is that popping vitamin pills guarantees against cancer. It's a huge myth. Please be aware that daily intake of multiple types of vitamins will not guarantee you protection from any disease. On the contrary, some of them might cause hypervitaminosis or excessive vitamins leading to toxicities. Ideally, vitamins should be taken after prescription only from your doctor, who suspects a deficiency either because of signs or symptoms or through a blood test. For a person with no deficiencies, balanced diet in the right quantity is more than sufficient. That's all for the myths and misconceptions and the controversies surrounding breast cancers. If you have more questions, kindly comment on the comment box and I'll try my best to give you the answers. Thanks a lot.